Right, I think we are ready to start on the webinar. So first of all, good morning, good afternoon, good evening to all participants, wherever they may be in the world, and welcome to everyone to this event, COVID-19 and its impact on gender, justice and security, an event that's hosted by the Gender, Justice and Security Hub and collaborative international research project located within the Centre for Women, Peace and Security at the London School of Economics. I'm Christine Schenken. I'm the Principal Investigator on this Gender, Justice and Security Hub and a Professorial Research Fellow in the Centre for Women, Peace and Security. Right, the event today is the opening event of a week-long convention for Hub members that will be looking at methods, creativity and innovation. Now, we would, of course, have preferred to have held the convention in person in one of our focus countries. But of course, the pandemic is making that impossible. But one of the advantages of hosting an event online instead of in person means that we can ask a wider audience to participate. And this is indeed one of the few convention events which is open to a wider audience. And we're extremely pleased to have you all here. And thank you for joining us. In just a moment, I'll introduce the speakers in today's panel, but before then, I'd just like to say a little more about the Hub. The Hub is funded by the UKRI Global Challenges Research Fund, and it works with academics, local and global civil society, practitioners, governments, and international organizations to advance gender justice and inclusive peace. It's working through 32 Hub research projects that are engaging with some major global challenges in 3 areas. The Sustainable Development Goal, SDG Goal number 5 on gender equality, SDG 16 on peace, justice and strong institutions, and the implementation of the United Nations Security Council agenda on women, peace and security. The research projects work across and beyond 7 conflict-affected focus countries around the globe. And then turning specifically to today's event, we are going to be discussing the impacts of the COVID-19 crisis on gender, justice and security. As we all know, the outbreak of the pandemic has simultaneously revealed both the fragility and the robustness of health, education, economic, security, political and social systems. We've seen no shortage of exceptional responses to the pandemic. We've seen physical lockdown of millions of people, mandates to return millions of people from cities to rural communities, restrictions on freedom of expression, for example, challenging government management or mismanagement of the crisis, data tracking on the movement of peoples, extensive border controls, massive vaccination programs. And this amounts to a broad range of political and legal controls that are far-reaching across all levels of public and private life, and also, of course, have far-reaching gendered implications. But also responses have included remarkable initiatives at the community level, often led by women, and to provide care where state services have failed, and to maintain some momentum for progressive policy agendas. So our speakers are well qualified to talk about these various matters. They are 3 co-directors from the Hub who in the panel today will be taking stock of the changing social and political landscapes, locally, regionally and internationally, 1 year into the pandemic. They will discuss how responses to COVID-19 have affected the fight for gender justice and inclusive security, and the impacts of the crisis on political and social rights. We'll also explore changing configurations of civil, public and private spaces, and whether the crisis brought about by the pandemic can indeed also offer opportunities for positive change. So our 3 highly qualified speakers are in the order in which they're going to be presenting. First, Dr. Josephine Ahiri, co-director of the Livelihood, Land and Rights research stream of the Hub and principal of the College of Humanities and Social Sciences at Makerere University in Uganda. Josephine's research focuses on improving the understanding of gender relations of post-war conflict associated with land acquisition in northern Uganda. Now, Josephine will be followed by Dr. Camilo Sanchez, co-director also of the Livelihood, Land and Rights research stream and assistant professor of law at the University of Virginia. Camilo's research focuses on justice in post-conflict scenarios, land governance and peace building, and the role of international human rights law in the Colombian transitional justice process. And then our last speaker is Professor Finola Ni-Aloin, co-director of the Transformation and Empowerment Research Stream on the Hub and United Nations Special Rapporteur on Human Rights and Counterterrorism. Finola has published extensively on issues of gender, conflict regulation, transitional justice, and counterterrorism. Each of the speakers will speak for about 10 minutes. Then we will have time for them to comment on each other's presentations, raise any other particular issues in a sort of interactive conversation between themselves. And then we will turn to the audience for questions and answers. So please, while you are listening to people, use the question and answer function to leave any questions you may have for the speakers throughout the event. Obviously, it's an advantage if you can keep the question short, include your name and affiliation, and then we will put those to the speakers during the question and answer in the second half of the event. The event will finish at 3:30. It will be recorded and posted online after the event, subject, of course, to any technical difficulties. So that's enough from me at the moment. So I will first hand over to you, Josephine. And thank you all very much for coming today.
Thank you very much. Thank you very much, Chair Christine. Good morning, good evening, if you are this side. I would like to talk about the COVID pandemic and gender justice, entitled "In the Name of COVID." For those who have been baptized, you know what that means. In the name of means that you actually become that identity. And I would like to share thoughts about this. So in a way, the pandemic has hit the world in unprecedented ways. It has taken humanity by storm. Everybody's hurting, those who are sick, those who are looking after the sick. There is extreme fear, but also we are looking at the gender subtext of this kind of situation. In Uganda today, as of 20th January, the total cases of COVID were 38,628 with 300 or so deaths and 13,000 recoveries. So the picture is not so gloomy, but the issue also is that there could be underreporting because most people are not able to actually do the testing. The cost is prohibitive, and so it's not clear that that is the situation. But that is the recorded one. And also there is a narrative around the fact that perhaps the numbers are exaggerated to get donor attention. There's a whole discussion around the loans that have been taken in the name of COVID by government to the tune of $808 million US as loans, and then 4.2 as grants. And the issue is that people don't see the relationship between what is being done on the ground in terms of the health care system, in terms of provisioning of water and so on. And then particularly the response has been, in addition to what the chair talked about, the lockdown and all that, the enforcing has been a more militarism than actually generative. And so the militarism has sort of legitimized or re-legitimized oppression, and it has sort of shrunk the civic space. And in there also, there is the gender subtext that we would like to talk about. And so COVID-19 has had a multiple kind of impact politically, socially, economically, bringing out all the inherent deficits in those areas, and therefore almost threatening to roll back even the few gains that a country like Uganda had made. And so are we getting the clear picture of the iceberg? How do we get the full view akin to the Titanic experience? And within this, the turn to the household is a very clear kind of response. So the executive orders were about stay home, save lives. And so this unprecedented movement to the public, to the private. Once again, we can say that modernity has been put to test in terms of the huge movement of people into the private sphere, especially men in this context, men who, even if they are not employed, they sort of would identify with the public and are sort of defined in that way. And so the family taken for granted as universal, as a heaven for love and unity, all of a sudden is reconfigured. And the household all of a sudden is turned into a hub of violence. In the 3 months of lockdown between March and June, over 3,000 cases were reported. And reporting actually means that there are more cases that go unreported. So in a way, the pandemic has reconfigured the household. And the way we see this is that there are the old deficiencies that have been unearthed by COVID-19. We see, for example, the decongestion of health facilities, meaning that all other patients were either discharged or told to remain home because of COVID-19. It was as if all other illnesses had given way to COVID-19. And in this case, we see a gender subtext of the increased morbidity within the households, as well as the burden of care that actually increases now with children out of school, they are all home, men all home, and the kind of division of labor within the home that puts a lot of care burden on the females. Then biology, cause. There was a dire picture of pregnant women who could not prove that they were in labor. For people to move, they had to prove that they were seriously sick, that they were dying, and this was given, the permission was given by the security sector in the district. And so a woman had to prove that she was in labor. A typically kind of masculine view of maternal health. And so we had mothers delivering on roadsides or even unattended to in the facilities, especially in the rural areas. And also, as I've said before, then homes were represented as prisons, and men staying home was presented as an unbailable jail sentence. And once again, then we see the institution of marriage coming to the fore, and there was a lot of discussion on social media in terms of what men were suffering. Men were undergoing stress, women were stressing them, women were checking their phones all the time. The phone became the battleground, all these things. And in the name of COVID, and what is called the standard operating procedures, there seems to be a reversal in social justice generally, the legitimacy for social justice. The population seems to be under siege, and gender justice has always been a secondary issue, but now it actually is receding to the real backwaters because there is no space for voicing some of these rights issues and so on. Rights have become secondary. What is forefronted is we have to conform to the SOPs, COVID-19 SOPs. And the expectations that civil society had, that people had, that there would be better investment in the healthcare system, in water, in pro-poor policies, in gender equitable strategies, all that doesn't seem to be happening. And there is more investment actually in the kind of repressive machinery and also less investment actually in the health. Even basic things like protective gear for health workers, things that seem to be very obvious in terms of the pandemic offering that opportunity to actually reverse the kind of investment. Instead, what is abundant is violence, corruption, increased morbidity at household level, extreme commercialization of healthcare. A facility that used to charge maybe $100 or maybe $50 is now talking about $5,000, $2,000. A single treatment of COVID came when the government had started earlier. It was really a free treatment for a few people when there were still 5 cases, 10. Now that there are over 30,000, the cost has actually gone up as high as $5,000. And the fear that COVID is real is not actually translating into positive response. So the kind of response is just about getting what the leaders would like to see. And we see therefore that gender justice in the post-COVID era will need a re-engineering approach because there are all these rollbacks that have happened. However, there's this newness that we need to put on the table. There has been opportunities. It has opened this black box to question the hegemonic beliefs upon which harmful forms, for example, of masculinities are constructed. We see permissive moments through which to re-engineer or the unlearning of men and what crowds them out of the household, because then men actually became socially dislocated. And there was this conversation about there is actually need for us to, for example, enjoy the home, enjoy being father and so on. And that revealed new experiences also, a number of men of fatherhood and the need for fatherhood of presence as opposed to fatherhood of absence, the sort of continued absence. I would like to thank you very much for your attention.
Thank you very much, Josephine, for that extremely vivid, and I very much liked the image of the iceberg. I quite agree. I think we're only seeing very much the tip of the repercussions that are going to be going on for a very long time. And now for a very different part of the world, Camila, I'll turn to you.
Thank you very much, Christine, and all the folks that have worked so hard to put this convention together. I look forward to all of the panels. I think they're going to be extremely interesting and useful for the times that we're living in. So I was called to talk about Latin America and how the pandemic has hit our region. And this is not a full comprehensive paper. What I wanted to present is some ideas just to trigger the discussion. So I didn't prepare the iceberg presentation, but as I only have 10 minutes, what I thought I could do is to use the logic of the meme, the idea of how it started, how it is going, and maybe add where to go from here to present how I see regionally some of the challenges, but also some of the hopes, because as Josephine put it, I think there are also opportunities. So first, how it started. The pandemic hit. When the pandemic hit, interrupted a simmering period of discontent in the region, in which citizens, thousands of citizens, if not millions, had turned to the streets in mass protests to demand changes to many different issues, but I would classify it into two groups. First, to combat and ask for changes for pockets of authoritarianism, although the region has made some progress in democratization over the past 2-3 decades, there still are many issues in which one could see a lack of democratic process in which decisions are made in different countries. So some examples, the Constitution in Chile, and why so many people were asking for an amendment to that constitution, or even a complete redo of the constitution through a conventional assembly. The lack of compliance of the peace agreement in Colombia, and these new policies of hardening drug policies, and many other of those policies, and even the police response to those protests. We saw all of these videos depicting the violence and the hardline response of police and security forces against peaceful protesters in the region. So there is one of the topics that was at the court of the request and of the protesters. And the second, I would say, is more of a social and economic matter. The ramping inequality, the lack of opportunities, and the lack of recognition of an entire generation. Issues ranging from economic and social inequality, the regressive fiscal systems of the region, the environmental degradation and the lack of action on the part of governments on that, the expansion of right-wing religious anti-rights ideologies throughout the region. So those are some of the many issues that prompted all of this period of discontent. So when people were mobilizing, asking for their rights, asking for changes, the pandemic hit and dialed back a little bit of this process. But all of these agendas are still there. And how it is going. You all have seen that Latin America has been one of the hardest hit regions. In the top 10 countries, we have Mexico, Brazil, Colombia, Argentina, Peru, and sometimes our leaders seem to be, in this contest for who makes the most idiotic response or remark. And AMLO in Mexico and Bolsonaro in Brazil, I think are top contenders for that award. But also we had early devastation outbreaks like the one that happened in Ecuador when we saw corpses on the streets. And so it's been dramatic. The toll's been dramatic in our region. And this impacted already weakened health systems, countries with limited capacity to mobilize resources, emergency resources. You know, you see in other regions in Europe or in the US that now they're discussing this 1.9 billion package, and our region doesn't have the leverage or the money to mobilize those sort of those needed resources as quick as in other regions they can. Our labor markets depend heavily on informal jobs. So many people had to risk their lives and ventured out their, these households and the home as this heaven, as Josephine put it, because they just need to make a living. To put food on the table. So there are many issues that made it not only in terms of the health crisis, but the social and economic crisis are very damaging for our democracies. And in terms of policy responses, we have had many different takes, intended or unintended, but I would say at least three types we have seen. First, full frontal authoritarian responses. And I think the case of El Salvador and President Bukele is the best example for that. We all saw those pictures of those young men in prison, in Salvadorian prisons, as how shocking these measures can be. On the second hand, we have these hybrid responses, and I would call here Colombia to be the example, in which there was this over legalization of the exceptional measures, but more than 300 different decrees, resolutions, and pieces of legislation, that were completely chaotic, and nobody actually knew what was happening. And the part of the government tried to sleep under the rug some authoritarian measures and dial back on some of their commitments. So we had that. And the third is complete lack of action or lack of leadership, as we've seen in Brazil, with Bolsonaro contradicting science and contradicting its own courts, and Mexico and other parts of the region. So it is not just one set of responses. There are different degrees of that. And when it comes to women and gender issues, we have seen a very impactful and regressive effect on gender justice and gender equality throughout the region. A lot of what Josephine shared, it's also can be also seen in our region, in Latin America, increase in different forms of violence against women. The Colombian General's Attorney, for example, found that the two most commonly reported crimes during the lockdowns were burglaries and domestic violence. Second, job destruction in what they call feminized sectors, the burden of unpaid care, and also some not well thought policy responses. There was one we called Pico y Placa, which is that this idea that there was like a gender traffic light in which women would could go to streets on one day and men on the other day, that were very damaging for certain groups of people, transgender people, and for many reasons that was not well thought and produced more damage than good, I think. And finally, because my time is almost over, where to go from here? Social protests and all of these processes are still alive. They didn't die because of COVID. They were put to a halt, but as Argentinian women saved the day, and they show us they're still there fighting for their rights, which is great. And I think at least there are three issues in which I think that some of these people could find agendas and ideas to mobilize around, and that there's now more consensus on them. First is how to develop novel schemes for protection of women facing domestic violence. and how to deliver social benefits and food rations to vulnerable families. I think a lot of good ideas have come up with this pandemic, and I think there are grounds to believe that we can ramp up on that and make it more sustainable policies. Second, the push for reforms to our unequal tax systems and fiscal systems. And the third, the implementation of an emergency basic income system, and a gender sensitive basic income system. Those are three ideas that have been around, and I think they could be important moving forward. And thank you very much. And I think I turn it to Fayanula.
Thank you very much, Camilo. Very great deal of information and very well within your 10 minutes. And I think the really important issue that, yeah, existing agendas haven't gone away, that when we read the papers, too often it seems like nothing in the world is happening except COVID-19 and responses to it. But so many of these other agendas are still there, are simmering below the surface, and we're going to have to be taken into account as we move into what we hope will be a post-COVID era. Finola, we turn to you.
Great. Thank you, everyone. And thanks in particular to Christine and her team for bringing us all together. So I'm going to speak from the perch. I have both my academic perch, but also given the work that the mandate I hold has been doing globally and seeing the impact of COVID-19, particularly on the protection of civil and political rights around the world. I'm going to speak from there. So as we all know, and we've mentioned already, the pandemic has stretched state capacity across the globe. As Christine noted, it has simultaneously revealed both the robustness and the fragility of public health, public education, transport, economics, welfare, and security systems. And so it's clearly, in some sense, the pandemic is a classic emergency. It's a crippling event for states, threatening many lives, and it has clearly crippled the capacity of many states to function. And as a result, across the globe, we've been seeing perhaps a parallel epidemic of legal and political exceptionalism. And I'm going to share with you all in the chat a tracker, a global tracker that the mandate I hold has been supporting, one created by two small NGOs, ICNL and ECNL, really tracking the impact of the pandemic on some core rights, as well as tracking the resort to exceptionality, what we might call emergency powers by states across the world. And so as we look at those responses, what do we see? Well, we've seen lockdown of millions of people, mandates to return millions of people to cities and from cities to rural communities, in many cases thereby spreading the health effects of the pandemic, restrictions on freedom of expression that challenge government crisis management, mandatory labor production, huge movements in data tracking and collection of data on the movements of people, often by non-traditional actors, so health actors rather than traditional security actors, extensive border controls and the application of new technologies on the border, and a broad range of political and legal controls that are far-ranging and are both wholesale and retail. And all of those measures have gendered effects. And I think it's important to note that one of the challenges we face is understanding both the scale of those measures, but also really sort of burrowing down deep to understand how they are affecting women specifically. What I want to start with is to talk a little bit about the kinds of emergency measures that we're seeing, and then talk about what the sort of securitization of the pandemic and what that means for, in particular, gender and women's rights. So if you look at the tracker, you'll see that formally we have 96 countries that have issued emergency declarations. Of those, we know that 50 include measures limiting freedom of expression, 130 that are affecting freedom of assembly, and 53 countries, at least that we know of, with measures that affect privacy. Now, I want to say that I think the tracker underestimates the scale of restriction on civil and political rights. This is what we can ascertain at this point. And one of the difficulties in this context is actually knowing what's happening on the ground. And this is happening, that difficulty or that unknowability of the effect of COVID is really because of the way in which the complexity of the management of COVID is happening. So let me identify 4 types of emergencies that we see, and then talk about how those are affecting a range of rights, including women's rights. The first are classic emergency powers, where the government is saying we have a health emergency and we have to limit these kinds of rights at this time. And so one really important thing to note, a lot to say about that, is that governments are consistently under-reporting. So even though we have measures of derogation in place from many states, we know that there's a systematic under-reporting of state measures happening, which means that we don't really know what they're doing, and our capacity to oversee what they're doing or to measure if their measures are proportionate, necessary, and non-discriminatory, our capacity to measure that is extremely difficult. The second layer of emergency powers, which have been alluded to by Camille, is the resort to what we might call excessive executive powers. So in many countries, we could think of Brazil, we could think of Hungary, we could think of also the United States. We've seen, in fact, not the parliament functioning to put in place measures through a process of dialogue and deliberation, but rather individual leaders taking power, and often security powers, to manage the pandemic. And that category of executive powers we could call under cover of COVID, where states are doing things that they could not otherwise do, using the pandemic as cover for their actions. The third layer that we see is what I would call de facto emergencies, or de facto exceptionalism in this space, which is where we see a range of security, surveillance, and rights limiting powers being put in place in places like health law. So all of the lawyers on the call will know, when we look for exceptionality in legal systems, we don't generally look at health provisions. And so one of the challenges we face is actually figuring out where the exceptionality lies and what the effects are, particularly on marginalized groups, but also on historically discriminated against groups, including women and girls. So the de facto space is enormous. The fourth area that we're seeing is the area that I work in every day, which is the repurposing of security, counterterrorism powers to the pandemic. And we're seeing an enormous amount of that repurposing and application. And I think that the thing I would stress in that area is, if we think about counterterrorism or security powers, powers that were developed in the area of war or insurgency or terrorism, right, where women and girls have historically struggled, notwithstanding the women, peace and security agenda, struggle to be visible, struggle to have a voice, struggle to have their issues and their concerns viewed as relevant. When we think of the sort of pandemic management leaning into that space, borrowing from that space, we then import all of the limitations of those spaces into the management of the pandemic. And I think we should also be profoundly concerned when we see pandemic management being managed in a way against communities. So we know as an epidemiological matter that the communities who are suffering the most and who are the most vulnerable to COVID-19 are communities of color, communities who have been historically disenfranchised from the state, and communities who have had historically weak, poor and oppressive relationships with the security sector. So again, we have to think about the consequences of what it means to have the sectors who are leading, whether it's in the repurposing of counterterrorism or from the classic use of emergency powers mobilizing the security sector of the state to manage the pandemic, what it means to have those actors leading the response of the state to a health pandemic. So those are the four areas I underline. Two other points of note. One is that those are not silos, so that in a number of countries, we're seeing a sort of a complexity of all of those measures being used at once, right? So that it's a really dense area in terms of securitized regulation. And the second is that historically, we have looked at countries from the top down and looked at what the central government is doing to understand what the impact of regulatory measures are. COVID really upends that regulatory scheme because in many countries, the most significant regulatory powers are being exercised at the local, at the city, and at the municipal level. So I take the example from Camille's home country. I take the example of Bogota, Colombia, and the particular role that the mayor of Bogota has played, actually a very positive role in regulating the pandemic, but it's at a city level. And so also I want to say for women's rights activists, for women who are at the forefront of challenging state power, we often think we have to go to the center. And one of the things that we have to think about in this new pandemic regulatory space is to understand that the sites of regulation are multiple, that they are mutually reinforcing, and that they are as a result really difficult to undo. Let me close by saying a little bit about what I think the dangers for the women, peace and security agenda, but more broadly for women, are from the militarized and heavily securitized response that we've seen to the pandemic. So first, it is that in general, these are not women-friendly spaces. They're spaces in which we've struggled to have both women's voices heard and where, in fact, the harms to women have been invisible. And I think that remains true in the COVID response. The second is that there is an innate resistance in these spaces to often seeing what Josephine and Camille has decided as the core relationship between public and private. Meaning, just as, for example, counterterrorism and security measures have, as huge costs on family structures and on women and girls, but the state is often resistant to acknowledging that. The impact of the way in which COVID is sitting in families and within the most private and intimate spaces, and the projection of the state's power into that private space, I think is one that we have not fully grasped as feminist scholars and practitioners, and understanding how we unwind that, I think, is going to be particularly challenging. The third thing I want to focus on here in terms of effects is the sort of global space and the kind of resistance we're seeing to addressing the negative effects of the pandemic at global space. Some of you will be aware that it was very difficult to get a General Assembly debate on this issue, partly because states were resistant to having the conversation and impinging on one another's sovereignty. More significantly, we've seen a really resistance from the Security Council in doing the same. So it is to say that we lack global leadership, not just to understand the kind of rule of law and human rights deficits, but also to name those deficits. And finally, let me close by saying that where do we go next? Well, where we go next, I think, is a need for meaningful global oversight of the resort to exceptionality, securitization, and militarization to manage this pandemic. And without that kind of meaningful global oversight and the political will to enact it, we may wake up the day after the pandemic ends with a health pandemic over, but a crisis of governance, human rights, and accountability that we will live with for several decades on our hands. Thank you.
Thank you, Finola. That's a sobering thought upon which to conclude, but I think a very important one, and one that we certainly need to heed. So thank you, all three of you. You've all kept wonderfully to your allocated time as well, but I'm sure you've all got thoughts that have arisen in response to each other. So I wonder whether Josephine or Camila, whether you would like to start by making any responses. I think perhaps another area that we could focus on in any such responses is you've all talked about the way in which the pandemic has impacted upon women and impacted upon constructions of masculinity and femininity, on gender relations, both at the very local, within the household, but also at a more community level. I wonder if any of you think that this is a moment where we may actually see some long-term reconstructions of femininity and masculinity, whether this is going to lead to a rethinking, in fact, of gender relations within societies, or whether, in fact, what we're seeing is, I think what we might say is a pushback at the moment, whether, in fact, that is going to be long-term and adverse, particularly for the protection of women and girls' human rights long-term. But that's just a sort of thought that I'm having. So responses, who'd like to, Camila, would you like to, have you got any immediate responses to your colleagues' very powerful presentations?
Yeah, no, I think they were brilliant, and I see a lot of the same issues that we've been witnessing in Latin America, in Africa, and in other regions that have been monitored by Fionnuala's and mandate and her work. To your question and to your idea, Christina, on how these policies have impacted women, I would say that right now there are kind of, as I see it, there are kind of two different discussions. I'm speaking here for the Colombian experience. One is the idea of the private sphere and how, for example, people has taken it to social media to complain about washing dishes and how much time you spend doing that or taking, care of the household. And that has triggered a discussion on that kind of work has been there all around. It's just that you're now paying attention because you're home. But it's been there and taken care for by women, for centuries, for ages. So how to, bring those discussions to, the realm of society and how we can, manage to share those responsibilities. So I think there's certain issues, but the underlying thing is that the burden of that, the brunt of that has been, taken by women that are the ones that are trying to keep their jobs while educating their children and doing all of the work at home, mostly work at home, and that's part of it's brought that to the surface, but it still shows a really, really bad picture of how we are as a society. And the second is the public sphere, and how this pandemic has erased decades of progress in terms of women in the job market, in the economy, and how we're going to prepare for and doing that, and how we're going to build back. And I haven't seen policies that are specifically trying to address that issue. And I think that's something that is very concerning to many of us.
Thank you. Josephine, any sort of immediate reactions or thoughts arising from fellow panelists or further things you would have liked to have raised?
One, I think something about gender relations at household level, they are sort of in a flux. We see on the one hand, these adverse effects and the increased burden and so on. But the lockdown seems to also have engendered a process of renegotiation. At one point, the sphere that was badly hit was the public informal employment. Now, informal employment that is not related to food, because food markets were not locked down. And what happens is that women in the informal economy, most of them seem to be in the food-related activities. And therefore, they were able to maintain some form of semblance of sustenance and bringing food on the table, actually. And so we saw a lot of frustration by men about, I cannot put food on the table, I cannot be a man, because manhood in this sense is only meaningful if you are in the provider role. And so all these tensions actually brought about a certain kind of discussion around, can men be men without money? And perhaps also we also saw a few or some men trying to bring in the narrative that actually you can be a man, you can enjoy fatherhood of presence, you can also be part of the home kind of economy without being an absentee. So I think that depending on how these renegotiations come along, there is a possibility of a renegotiated identities around masculinities and femininities. That is what we are seeing. And the discussions in the media, on radio, is actually ongoing. The other thing I wanted to ask, especially at the UN system level, was that historically we had something around the global women's movement. Is this the time to actually actualize, maybe beyond SDGs and so on, to sort of imagine a global women's movement that sort of captures these moments and uses them to bring a kind of conversation that can then change the way nation states are sort of engaging within the whole UN system. It was just a question, and I was just wondering how we can engage with that. Thank you.
Very important question, I think. Finola, have you got any response to that? Any other further sort of thoughts, again, arising out of both Josephine and Camilo's really helpful and very stimulating comments?
Yeah. No, I mean, I think we are in this moment of tremendous flux, and it's really interesting for the Gender Hub, where we work on like situations of conflict and transition. We know there's this odd, it's almost a paradox that in times of great harm, in times of great change, where there's enormous difficulty, there's also enormous opportunity. And we know that from sort of those of us who worked on conflict or work on conflict. That said, I think we're facing enormous challenges to really meaningfully translate that into opportunities for women and girls. I think one of the challenges, or one of the positives, is that if a decade ago we were having a debate about whether health was a human right, I mean, I think we're done with that, right? Because, you know, we locked down the world for health. So it feels to me like one big moment to capitalize on the losses that Camille has rightly identified is actually this consensus on what things are rights: health as a right, water as a right, a home, a place to be safe from all of these things. The cures to the pandemics have to be rights. And I think really that moment of really capitalizing and affirming these things will be really important to make back the losses that we've certainly seen in the public space for women. To Josephine's question about the system, it worries me enormously right now. As you know, one of the challenges for the pandemic is that civil society space, including women-led civil society, is shrinking, and human rights defenders who are women are still being killed every day around the globe, notwithstanding the pandemic. The work they do, the issues they work on, which have not gone away and they are still working on, have made them doubly vulnerable because the world's not watching their deaths or their repression simply because it's too busy worrying about survival. So I think that's an enormous challenge. And I think the other challenge is the pandemic, despite Zoom, the spaces that were created globally are less accessible, partly because of the way in which the pandemic is constricting space. It's constricting the space for discourse, whether that's at the Security Council, the General Assembly, ECOSOC, all of these spaces and regional spaces. And so I do think that we will have to pay really close attention to the health of women-led civil society and nurture it, because in it is really the roots of what will build back what we have lost, but also reimagine it, right? How do we reimagine some of these things in a post-pandemic world?
What we
If I
hope
can
is,
add,
yeah, Camilo, great, come in.
yeah, on that question, I think we need to pay a lot of attention, study, promote female leadership and what female leadership has been in the past year compared to toxic masculinity kind of leadership. And if you look, for example, at the president or the prime minister in New Zealand, the mayor of Bogota, Angela Merkel's, and you compare that to, you know, some of the clowns in other countries that, to put it mildly, some of these people, and you compare the kind of responses and where they put the focus on, and if we can, channel that in order to make it a way to produce a more inclusive rebuilding of what we lost, I think that's going to be key. Otherwise, I'm afraid that we're going to go to business as usual, and all of these policies to put the economy back on track, or many of the other policies are just going to be gonna end up leaving behind all of those people that we care about.
I think it's really interesting as well that all the rights that Finola was just talking about, health rights, clean water, shelter, etc. They are all the classic economic social rights. And for years and years, the Covenant Economic Social Rights has been the poor relation, are they really rights, and so on. And the one thing the pandemic has made absolutely clear is the vital role of the state at guaranteeing those as rights, as entitlements, not just as welfare policies or aid or something that we may grant, alongside sort of other policies. So the recentering of the rights discourse, I think, is perhaps another really important part, without losing all the other points relating to the civil and political rights. Anybody else want to come in at this point, or shall we turn to questions from the audience? Some are beginning to have just come in. So Eric Biebelhaus-Brahm, I think his name, from the University of Arkansas in the US, has a question for all of you. He says, you've all raised important concerns about state responses. So building on Finola's point, can you identify more examples of effective response, particularly from a gender-just perspective? Perhaps local level government or NGO-led initiatives. Is Bogotà's example exportable? So I think he wants further details, further examples of what are important, appropriate, forward-looking state responses, and particularly from the local level as well, or NGO-led initiatives. And then Mario Gomez from the International Center for Ethnic Studies, where we all were last year, has a question particularly for Finola, but I think perhaps the others you may both have something to add on that. He says that in Sri Lanka, there's been an increase in hate speech against religious minorities. Muslims in Sri Lanka have been fighting for respect for their burial rights. Is this a global trend? Are religious and ethnic minorities encountering further discrimination as a result of the pandemic? So particular issues about, I think it was you, Finola, who did raise the issue, and I think actually all of you touched on, is about which particular groups are most fiercely being attacked, both by the pandemic and then as a consequence of responses to the pandemic. So I think sort of building upon that idea, perhaps particularly issues around other minorities in both Uganda and Colombia would be interesting. So 2 questions there relating to state and local responses and particular issues around religious and ethnic minorities and discrimination against them being highlighted because of the pandemic. Who'd like to start? I asked Camilo a moment ago, so perhaps Finola, would you this time?
Sure. I guess what I would just to answer Eric's first question about sort of good examples, and I think that's also one of the things we have to elevate, which is often hard because we're living in a universe of imperfect information. But I do think we have a lot to learn from the environmental movement and the way in which we've sort of crafted the idea that city-led, regional, when we have an absence of a concerted global capacity, and global capacity has obvious fault lines around state power and sovereignty, that one of the really innovative places to go is actually to look for these sort of multi-layered legal and political responses. So Colombia's, I think, Bogota, Colombia is an interesting one because we have actually very different city models in Colombia. We have a really good example in Bogota, but should I say a more complex example in Medellin. So it's not, even within countries, we're seeing enormous variation. I think the other thing I think which is really exciting, and this is in the most difficult circumstances, we're seeing amazing litigation. I mean, I'm going to take the example of Botswana, where when the COVID legislation came out in Botswana, it turned out that lawyers weren't considered essential workers. So I'm biased, of course. I think all the lawyers in the room think they're special. But I will say that one of the immediate things that the Lawyer Bar Association did was they went to court and said, of course, lawyers are essential workers. How are we going to have justice systems and accountability by the state unless we consider lawyers essential workers? So I also think elevating these stories of disputing, claiming, agitating against the state are really important. And it's interesting to me that we're seeing much less, I know less about where we see that kind of proactive work being done on women's rights. I see negative. So if we think of the decision by the US Supreme Court last week, which essentially says that women, the burden on women to seek abortions and to seek abortion care is going to be heavier actually during the pandemic. It's going to require them to show up in person. So again, sort of looking at where we have had wins, but also where states are using the moment to really limit women's rights. And I'm going to share in the chat, my colleagues at the United Nations today have issued a press statement exactly on the issue Mario has identified, which is that compulsory cremation is a violation of the most fundamental right to belief. And bear in mind, the right to religious belief is an absolute right. It's a right that's particularly protected under international law. And here we see a really what can only be described as a discriminatory model focused on a vulnerable marginal minority, which has already been subject of significant repression by a country. And to affirm, Mario, that is not unusual. The patterns of that across the globe are numerous and regrettable.
Thank you. Josephine, anything to add to either of those questions? Josephine, are you still on? Yes.
I was trying to get any best practices.
Right.
I couldn't. Yes. Am I on? Yes.
Yes. Yeah.
Yes. Eric, there is difficulty actually in getting or looking at good models in a situation of extreme fear, extreme repression. At the beginning of the pandemic in Uganda, the first month, the first and second month of the lockdown, there was some kind of optimism where we saw a sort of combined efforts between government, civil society, religious leaders, educational institutions. There was a lot of donation that happened in order to deal with the disadvantaged, a lot of food that was donated. But quickly, people realized that that intersection was not going to live for long, because then quickly it was realized that the issues, the notions and all that were not actually being put to good use. So I'm saying that at one point, that intersection that had happened could be a good model for a country that is struggling with a healthcare system, water provisioning, and so on, if those things can actually be put to good use. I think that's all I wanted to comment on that.
Thank you. Camila.
Thank you.
Thank you. Sorry.
To go back to local responses, I think there are some that are good ideas that we need. Just of course, I don't know if they're good models for everyone, and you know how different societies need to reflect on if they want to take part of them or not. But I think one good one was this partnership between the mayor's office and convenience stores and pharmacies to use them as sites for reporting domestic violence. You know, because those are where the only or two places where many of these victims went to during the lockdown, right? To the convenience store, to groceries, or a pharmacy to get medications, and how they turned that into secure reporting sites. So then public authorities could get to know what was happening, and then respond to that. So I think that was a very brilliant move by the mayor's office. A second example, I think, is the discussion that was triggered in Colombia, given the initially the government decided or made a statement saying that migrants, and mostly Venezuelan migrants, were not going to be vaccinated. In Colombia, nobody is getting vaccines because vaccines have not arrived yet. But he said, once we get them, we're going to vaccinate Colombians and not irregular migrants. And that triggered a discussion on different issues, from ethical human rights perspective to a health and security perspective, saying that it's either we all get vaccinated or it will not work. It doesn't work that way. Your hate and your idea of dividing us by borders is completely nuts when it comes to a health threat. So I think those, and now they backtrack that and change their mind, and kind of human rights, ethics, and health triumph that idea. So those are, I think, good examples of positive developments, I would say, that might be replicated somewhere else. Regarding particular groups that I consider have been severely hit on, are those who are in the risk of being left behind. I would echo what Fayonula mentioned moments ago, which ones are the groups that we are now seeing in the surface of this, and informal workers, minorities, but there's also a group of the invisible, those who have been fighting for the rights of other people, social leaders, human rights defenders, that now are just part of a background, and a background that nobody wants to touch, and people are busy on other stuff, and they're just there as invisible victims of this. And I would reiterate that call for not letting those behind.
No, I think that's a really important point. And I think both of your points have also added another dimension to the whole concept of prohibition of discrimination. And sort of thinking about what do we really mean by discriminatory practices and the requirement to prohibit discrimination in this sort of new context, which I think is really important. There's another question that's come in that really relates, I think, very much or builds on the question that we've just had from Mario, which is a question from India. The person says it's for all speakers. And the questioner says, we've seen a rise in India in child marriage, as well as violence against women. Do the panelists have information about other traditional practices, customs that are oppressive, particularly oppressive to women? that have come to the fore during the pandemic, and any particular information about those. And further, the question goes on, any particular points that anybody can raise relating to women's mental health and the whole mental health aspects of the pandemic. And then we have another one from Freya Scharelmann, if I'm pronouncing that right, from Germany, who's building upon your remark, Camillo, on business as usual. And she says that this has been a worrying trend all over the world. On the local level, we see the pandemic increasing solidarity. On the global level, this solidarity is lacking. How can the increased securitization and militarization be channeled to increase the security of women? I think that's actually really two separate questions. One is, how do we build? I think Finola already touched on this, but how can we build some global solidarity and leadership? But then, can increased securitization and militarization be channeled to increase the security of women? Or is that a complete contradiction in terms? Who would like to go first? I think I've asked all of you in turn. So perhaps Josephine. Are you there?
Yeah, yes, I'm there. The issue about increased child marriage, actually we had appalling statistics on teenage pregnancies in this very period. So these are not because of COVID, but a result of the broader social dislocation where people even abuse power within their vicinity. And so I think the issue is, how shall women's rights organizations or civil society organizations reimagine themselves to actually engage with the new realities of this open lead that has actually shown us all the deficiencies within our kind of system. The issue around women's unemployment, this is not really uniform across the all classes. For some women, the pandemic enabled them to expand on the businesses that they are doing. Businesses around food, businesses around small kinds of provisioning, mobile provisioning, all these, some of these things have expanded, and therefore not all women are in the victim kind of class. But generally, we see that there is a slump. There is a lot of difficulty in people who depend on the services that were locked down, or because of the slowdown, there isn't that much that is happening. So definitely poverty levels have gone up, and women also tend to be a majority in that kind of class. And for us, we also have the urban rural dichotomy, whereas the rural populations were not really like locked down because they were allowed to continue with their agricultural activities. They are in the backwaters because now all the other services that require cash income have gone up, and therefore then you see that to access health for women who have to access health for themselves, for their children, for their spouses, all that is combining to actually make the life a little bit more complex. That's what I can put for now. Thanks.
Thank you, Josephine. Camillo, any thoughts on either of
Yes,
those?
I would like, I don't know about traditional practices, but I would like to say a few words on mental health.
Yeah.
And I think mental health, at least in Latin America, or largely in Latin America, is an issue we don't talk about. It is, in this macho kind of culture, it's a sign of weakness. So this idea of getting services for mental health related issues or talking about that is just not part of our traditional conversations. So I see as a positive development that people are talking more about this and are bringing this to the table and asking hard conversations about and hard questions about how this impacts life in households, in public spheres, and how to craft policies in order to achieve that. And I see that here we can, for example, countries like Chile, Colombia, Argentina, that have built and they have hard-won lessons on how to deal with direct trauma, vicarious trauma, because of the harms inflicted to victims of violence, of conflict violence, and all of what we've learned there. That has not transpired society, and largest sectors of population don't know about how we have dealt with that and created these systems in order to cope with a lot of that can now be used by larger parts of the population that are trying to seek for answers and ways to cope with what they're dealing these days. So I think there is an important opportunity to connect those parts, not only to share those experiences, but also to show society how important to build that is, and to maintain and sustain those systems moving forward. And again, regarding global solidarity and security and women's security, I will call again to look at how this sort of female leadership has been shaping some of these agendas, and moving from the idea of security seen in an unidimensional way, to include discussions regarding care, discussions regarding human security, discussions regarding community, and how different members of the community need to be invited to be part of these conversations, and how that important is for having efficient systems to combat threats, different sorts of threats. I think that's important moving forward, both at the local and national level, but also globally.
Thank you. Antonella.
Well, I just would say briefly, I think that, solidarity is an enormously evocative word, and there's a way in which we could develop new vocabularies of transformation and solidarity and connectivity. And I think one of the challenges is that those vocabularies and the kind of capacities they invoke are really being squeezed out by the dominant discussions, which is around securitization, militarization, management models. And here in particularly, I would just stress the extent to which, and I think this is a real challenge for the women, peace and security agenda, is that in fact, the ways in which the infrastructures of security are now being redeployed to do essentially the expansion of that into COVID-19 management across multiple states, I think is a really insidious creep. It's not one that's informed by the kind of principles of gender justice or women's engagement. And I think that speaks to a more profound sort of reckoning for the women, peace and security agenda, is exactly what agenda are you maintaining and supporting in these spaces, and whether or not you really should be in that space. So I have some real deep concerns about that. To use, I think, a phrase you coined, Christine, we become a decorative fringe on the edge of a table somewhere. So it's maybe time that we got off the table and set up our own space. So I think really profound questions of strategy, where we are, who do we want to be aligned with in the transformative moment? Do we try to change other people's agendas, or is this a moment of really significant stepping back and reassessing and resetting different kinds of agendas?
Which I think we're coming very much to out of time. And I think that leads on to another question that we have here. So I'll put it to all of you and say, can you just take a final to think about this last question, and then perhaps just any other final comments that you'd like to make before we wrap up. This comes from Ruth Wig, I think, from the United States. And she says, do you think there are going to be adverse issues that cannot be erased after the pandemic? What policies do you think we should start with for inclusive rebuilding? So the looking to the future. And as I say, I think that picks up very nicely from where you just left off a moment ago, Finola. So any sort of priorities you think of for rebuilding for the future? Concerns, again, I think you've all raised already about what we might be left with that cannot be so easily erased, and perhaps any final thoughts. So again, Camilla, I'll start with you this time, then go to Finola, and then finish with Josephine.
I'm a very optimistic kind of guy, so I would say that. So I would say that there's a lot of challenges, and I think this definitely will break history, at least recent history, into two, because I think, at least speaking for my region and for Colombia, I think the work ahead is challenging, and will take us a lot of time to say that we've overcome this threat. But I don't think that there are necessarily things that are going to be meant to stick. It is if we let them stick around that there are going to be, these unsurmountable challenges or stains in our history. I think reconstruction needs to be inclusive if it's going to work. Otherwise, I don't think that's going to cut it. Second, as I mentioned, at least in our region, we have a new citizen demands that are still there, and people are still going and finding more creative ways in order to go to the street and protest and fight for their rights. So I don't think they're going just to let that some of these policies just get away with going back to business as usual and curtailing the rights of those that's been oppressed. So what I see is that there's going to be a very important round of renegotiations, both in public and private space. And what I think is that we need to start having those conversations on how to make it more inclusive, starting with vaccine policies and global vaccinations. If you look right now at the map of how vaccines are being delivered and all of the doses, you see a very frightening picture of the world with a huge divide south north hemispheres in terms of that. So I think starting with that, there are many conversations that we need to get ongoing, and I'm happy that we are providing some platform to start with those.
Thank you very much. Finola.
So briefly, the adverse issues that I think we will really have to reckon with. Well, I'm a one-line securitization. I think is going to be an enormous. But the other thing I think we haven't talked about is technologies. So one of the things that we're seeing right now, I think, is the enormous adaptation, and particularly data collection, data use, data storage, the ways in which that has massive impacts on privacy, on the regulation of women's lives, on ways in which actually data itself and is algorithmically structured to discriminate, and both in racial and gender terms. So the construction of new technologies and the ways in which they have been harnessed during COVID, and the ways in which that may become hardwired. I think that's an enormous adverse piece that we have not reckoned with, and not least because people are downloading apps and giving away all their information happily because they're afraid. So that actually is this complex space of where it's not about the state taking, it's about individuals giving with limited understanding about the long-term implications of privacy as a gateway right to other rights, and the ways in which that can be exploited by the states. by states. And how do we do it better? I think we have to, we are still, as a women's rights movement, we have to be against, we have to go back to our roots. We have to be against the militarization and securitization that has never served women's interests well. And that is, I think, where we start, and we go back to ground principles. These aren't new ideas. We just reinvigorate our engagement and the necessity of them in this moment. And that's what I would say.
Thank you. And Josephine, final word.
Thank you very much. What shall we be left with? I was reflecting on that, and sitting on the African continent, broadly known as the Global South, there's something that has happened in terms of the sort of relative delegitimation of the orthodoxy of neoliberalism. That is one, but also the fact that each country is struggling. There isn't space for hegemonic kind of discourses across countries. And this could be an opportunity for Africa to sort of also be able to identify solutions to its kind of challenges. We saw this during the pandemic, during the lockdown, the heavy lockdown. We had universities on the African continent coming together, having several webinars in terms of technological advancement, in terms of social responses and so on. And I think that if that could actually be allowed to fruit, we could begin to see a new kind of power shift in terms of the sort of African identity, and also in terms of the neoliberal orthodoxy in economic policies, social policies, and governance. Thank you.
Thank you. Well, thank you all very much. We are out of time. I'm sorry for people who'd sent in other questions that we haven't yet been able to get to. I've been asked to tell the audience that there are 2 other public events as part of the Hub Convention during this week. The next one is on the 27th of January at 4 o'clock London time. And this will be discussing COVID-19, the land policy of Sierra Leone, and the implications for gender justice and livelihoods. And other information about the Hub activities will be found on the Hub website, and that is being posted on the chat function. So all that remains for me to do is to thank the speakers very much indeed, from across their different time zones and different times of day, but for their extremely well thought through, informative, and I think optimistic remarks in many cases as well. So thank you all 3 very much indeed. Also thank you, of course, to the audience and for the participation, and for the team at the LSE who've made the technology and so on possible, and for all other Hub members. I hope the rest of the convention goes as excellently as this one has. And so I will now close the event. Thank you all very much indeed. I wish we could do clapping in the usual way, but okay.